to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome to Ask the Patient Advocate podcast, where we discuss all things related to navigating your health. Today, we're diving into another real-life story of how patient advocacy can transform healthcare experiences. Our client, Anna, had many undiagnosed symptoms, which included severe fatigue, where she was found to have continued anemia and required weekly blood transfusions. And this was for years. Imagine having a blood transfusion every week for years. But unfortunately, she never had a diagnosis. And so that's why these transfusions continued. So in addition, she, like many patients, had other medical conditions, including anxiety, depression, gastritis, diabetes, osteoporosis, and GERD. So all of these medical conditions also kind of added to the complexity of coming up with a accurate diagnosis for her underlying continued anemia. So after working with her, we were able to assist her with obtaining an explainable diagnosis, managing her symptoms, and getting her off weekly blood transfusions. Thankfully, she is now able to enjoy her daily activities and hobbies that she previously was unable to participate in for so long. Managing multiple conditions can be overwhelming, but with the right support, it becomes much more manageable. So joining me today is Christine, a member of our team. So welcome, Christine. How are you doing today?
Hi, thank you. I'm good. How are you?
Good, good. I love having you on. It's so much fun.
Yeah. Thank you. So, hi everyone who's listening, and I'm really excited to share Anna's story and how we've been able to support her through her healthcare journey. So, Anna had multiple medical issues at what have Dr. Borelli said, and finding diagnosis was very challenging. She needed referrals to specialists who could best address her conditions, but finding the right doctor and scheduling appointments was a major problem. Dr. Borelli, can you share how we assisted Anna in this process?
Absolutely. So Anna had been struggling to find specialists who could work together to address her complex medical needs and ultimately work together so that an actual diagnosis could be identified. Her primary care provider had referred her to several doctors, but getting appointments was really difficult for her, especially in the community that she lived in. And some of the specialists were not very helpful in offering a solution, even when she was able to arrange and attend those appointments. So we stepped in to help by first coordinating directly with the primary care physician and the specialists. We also identified doctors who were not only experts in their respected fields, but also had experience managing patients with multiple conditions similar to hers. One key thing was that after reviewing her medical records, I was able to identify a few things that she was not evaluated for. And we ensured that each specialist was informed about Anna's entire medical history, which was crucial for her comprehensive care. So, after discussing with Anna, uh, we asked for genetic testing, which was one of the things that identified that she did not have. So, through this genetic testing, it was found that Anna had a very rare genetic disorder that was the reason why she was anemic. And this was a huge milestone in Anna's journey because not only was the diagnosis identified, but there was an actual known treatment that Anna could try. So she was started on this treatment by her specialist, and immediately she responded so well. It has now been about, I think, 2.5 years now. And
Yeah.
right. And since then, she has not required not one blood transfusion. So that's amazing.
Yeah, I know. And I remember when Anna had no idea how to find the right doctors or even how to get an appointment, right? So she came to us feeling very rejected by the medical system, and she told us no one cares to help her anymore. So,
Yes, yes, I do remember that. It was definitely a team effort, and I'm so happy that we were able to help Anna in the way that we did. It was a great result for
yeah,
sure.
it's amazing. Now, let's talk about how we handle and offer our virtual support during her doctor appointments. Anna had difficulty explaining her concerns and questions during appointments, right? So, which often left her feeling unheard and unsupported.
Yes. So Anna often felt anxious and overwhelmed during her doctor visits. We virtually attended her visits, and that made a huge difference. So this allowed us to ask critical questions and ensure that all of Anna's concerns were addressed. So a lot of people will ask me, can you come in person to these
Yeah,
visits? And most often I am not able to attend in person, but I'm able to attend virtually. And the reason being is because I do have clients all over the US as well, and a few other countries. And so it attending in person makes it challenging because of the demographic locations and so forth. However, it's much more cost efficient and equally as beneficial by attending virtually, because then you're not being charged the time that it takes for transportation and travel, like, and so forth. And then also I'm more readily available to attend these appointments because I can attend them virtually. Um, but in addition, if there's rare cases or certain instances where a client really prefers in person, if we, depending on the location and the
yeah,
time frame, I can attend in person, or we can have one of our members attend in person and then coordinate with me as well.
yeah,
So we can make whatever necessary arrangements that need to be made, for sure, depending what's best for the situation and what our clients feel more comfortable with.
yeah,
But back, right? So yeah, back to that. Being present really allowed us to advocate for Anna in real time. So we clarified medical terms, explained treatment options, and made sure she understood the care plan afterward as well. Our involvement ensured that nothing really was overlooked and that Anna received the comprehensive care that she needed. And I think that's such a huge difference, because how many times, Christine, do we have our clients say, like, we went to a doctor's appointment and we left and we're so confused. We don't even know what the plan is, or none of our questions got answered, or things like that. That's
yeah,
right. How
every
many times?
single day.
Yeah, and so then when we go with them, or even if sometimes patients will say, like, "Hey, or can you, like, help prepare for the appointment?"
I
They don't
know, yeah,
usually attend. It's still a huge difference. They just come out like, "Wow, I actually accomplished something. It wasn't a waste of time," and things like that. So it's such a big, I think that's one thing that you can see, like, a huge, huge difference from, like, the before and after.
yeah, yeah.
So yeah, that's kind of I think one important thing, one of the many key aspects that we really helped with in this situation.
Mm. Yeah, I remember she was really grateful when you attended her appointments because she felt like it was a relief that there was someone who explained everything to her, and you have like a list of questions to ask this certain provider. So I think that really helps her understanding what is happening, like what is really happening with her health. And
Yeah, exactly. And, being on the other side as a healthcare provider, I can understand and appreciate it as well, because having a patient come in with, like, set questions and just sort of prepared for the process makes the visit
yeah,
go more smoothly too, so that you're not just staying, the provider is not staying extended time. And then they also have more of a positive, their patient has a more positive experience as well with them. And then both sides are happy, basically.
I
So
know, yeah,
I really like that. I think it's a win-win for everybody, to be honest.
right, yeah. Absolutely. And it's rewarding to see how much of a difference we can make. And Anna's story is a reminder that with the right support, managing complex medical conditions becomes much more manageable.
Agreed. So Anna's story is just one example of how patient advocacy, specifically private patient advocacy, can help overcome your health challenges. If you or a loved one are facing similar challenges, don't hesitate to reach out. We're here to help you navigate the healthcare system, whatever aspects that may be, with confidence and ease. So thank you again for tuning in to Ask the Patient Advocate podcast. And until next time. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.